So I'm Emma, so I'm the EPEC coordinator for here in Flintshire. So we've got a presentation that we've put together today just to sort of showcase the work that myself and Jen, who is one of our parent group leaders, and Paula and Chandrika completed last year, really. So we launched our project during the pandemic, and so we wanted to find out whether or not the programme that we deliver had an effect on the parents during COVID.
You're on mute, Emma.
Sorry, I'm pressing all buttons, and so it's muting and doing all sorts. So this is the content that we're going to cover in the presentation this afternoon. So we will, the four of us will sort of go through everything, and then there'll be an opportunity for questions at the end. There we go. Okay, so the study aim and the objectives. So we wanted to capture the parent group leaders and parents' perceptions of the impact of engaging in an online parenting programme, which is called Empowering Parents, Empowering Communities, which was delivered during the COVID pandemic. And we wanted to see if it had if it empowered the parents that attended the sessions. So there was 4 objectives that we wanted to cover. So the first one was to understand the experiences and needs of the parents of children that attended. So we will go through details of the parents that were involved, but just to give you a bit of an overview, there were 7 parents and they all had children between the ages of 4 and 11 that took part in this research project. Our second objective was to identify parent group leaders and parents' perceptions on the benefits of the online EPEC programme that we delivered, and then to explore the ways to draw upon parent voices to empower parents and families. And then the last objective was to use the findings to further develop of the EPEC programme. Go to the next one. Ooh. There we go. Okay, so the timescale. Paula, do you want to talk a bit about the timescale?
Yeah, well, we started coming together in March, mainly, I think at that point, just dipping our toe in the water to see if we could do some collaboration. And we met with yourself and Gail, the Early Years Family Support Services Manager. And then we were sort of seeing, I think the interest really, COVID was still very much sort of like we were like assessing the impact COVID had on families and young children. So we then had to obviously put our application through Chester University Ethics Panel. And then it takes quite a while to get through the ethics, so it did push it back a little bit, some of the work of working with the parents. So I think that was done over May and June time, undertaken largely by Emma, and some of the parent group leaders supported Emma with that data collection, and we'll say more about the methodology shortly. And then I would say the September and October was actually analysing the data and actually publishing the report. And here we are now delivering some of our findings from the report.
Sorry, I'm not used to Teams, and so I lost my unmute button then, so I'm sorry. Let me just go back to full screen. There we go. Okie dokie. Yeah, so during the sort of summer last year, we undertook the research. So that was conducted sort of July and August time, where I conducted the interviews, and we'll talk a bit more about that shortly. And then sort of September, October, Chandrika and Paula analysed the data and put together the report that we're sort of sharing with you today. So you're probably sitting there thinking, what on earth is EPEC? So EPEC stands for Empowering Parents, Empowering Communities, and it is a programme which was developed down South London and Morsley's NHS, and it was developed a number of years ago. And it is a programme, well, it's a project that provides parenting groups to parents, but it's slightly unique in the fact that it is delivered by parent group leaders. So Jen, who's here today, she is a parent group leader, but she is a parent herself in Flintshire. So EPEC's been running for a number of years now, and it's across the whole of the UK, but it is also abroad in places like China and Chile. But we're really fortunate in Flintshire because we are the only county so far in Wales that actually offers this programme. Since we've launched it in Flintshire, there are a couple of other counties across North Wales that have now sort of expressed an interest and are looking into it a little bit further. So what EPEC does is we bring together different communities and we deliver a programme called Being a Parent. That's the sort of foundation programme. So Being a Parent is an 8-week programme that is run by parent group leaders, and it focuses on children between the ages of 2 and 11, and it's providing support and strategies for lots of different things. So each week we cover a different topic. So we explore feelings, how to encourage children to express their feelings. We look at play and how play can be a vital part of a child's life. And then we move on to sort of discipline strategies using sort of positive parenting. So Being a Parent is sort of the foundation programme that EPEC offer, and then there are a number of other programmes that can also be offered. So in Flintshire, we first focused on the Being a Parent group, and then last year we started the Baby and Us programme as well, which again is an 8-week programme, but that's looking at 0 to 1-year-olds. Jen PGL, is there anything else that you want to say about EPEC?
No, Hannah, that's fine.
Fab, okay. I'm just conscious that I can talk about EPEC for days and days. So yeah, but it's a fantastic programme, and it works really well because how we deliver it is with parent group leaders, but those parent group leaders have actually gone on the programme themselves prior to it. So the majority of our PGLs have attended Being a Parent as a parent themselves. They've enjoyed it so much that they've then gone on to train to become a parent group leader. And the training is quite extensive. It's a 12-week training programme that they have to complete 1 day a week over those 12 weeks. But what we found, and we'll talk about this a little bit more in the research that we've come across with what Paul and Chandrika did, was we found that the parents really benefit from it being delivered by other parents, because the likes of Jen, she can talk about the strategies that we deliver it in the group, and Jen's got the positives to using it with her children. Jen sort of lives and breathes EPEC, so she can talk about what's worked well for her. So, sometimes the strategies don't always work, but also it's then delivered in like a non-judgmental way, because it is run by parents themselves. Okay, so going on to sort of how we gathered the data for the study. So Jen, you're going to talk about the PGL data, aren't you?
Yeah. So it was undertaken by the EPEC programme coordinator and involved a number of semi-structured questions towards the parent group leaders. So I'll give you a couple of examples. How have you found the parent group leader role, and things that work well for you, anything that is challenging or could be done differently? Also, how did it feel to be running sessions as a parent group leader during the pandemic? Was any specific support required by parents, and what were the main challenges faced? Also, what benefit do you think there is of being a PGL, delivering sessions and having a key role? And how are you personally benefiting from being a parent group leader on the EPEC programme? It was really interesting to complete these questions for me, particularly because delivering it to other parents, it made me think about my answers first and foremost, and so obviously engage in that, and also to make sure that I answered the questions thoroughly enough so that you could get the data required. So yeah, there were 7 of us that took part in that.
Yeah, and we did it over two groups. We clubbed the parent group leaders together as with who they trained with. So Jen was in one group, and then we had the other parent group leaders that trained the following year. It was all conducted on a virtual platform so that we could record it, so that it was easier to gather the data. And then after I completed the parent group leader interviews, I then went on to interview 7 parents that had participated in the Being a Parent programme over COVID and during the lockdowns. So I interviewed 7 parents. They all had children sort of between the ages of 4 and 11. However, one parent did also have sort of 13, 14-year-olds. In fact, I think she had a 19-year-old as well. The parent questions were, I asked them on a one-to-one basis rather than a group basis, just because Paula and Chandrika and myself felt that we might get a bit more information from the parents if it was on a more one-to-one basis. I also invited some of the parent group leaders to those sessions with the parents, but I made sure that the parent group leader that was also involved was the parent group leader that ran the session with that parent. So some examples of the questions that we asked the parents, I asked them was, what did the parents regard as the key areas of support which was required when they attended the group? And what we tried to do was get the parents to think about the goal that they set at the start of attending Being a Parent, and thinking about the reason why they sort of signed up to the Being a Parent programme, and you know what they were hoping to get from the 8 weeks that they attended. We asked them what they gained from EPEC. And I found that really interesting because some of the parents that we interviewed, it'd been about a year since they'd attended Being a Parent. So it was really nice to sort of go back and speak to the parents, but to find out that they were still using some of the strategies, and, you know, they were talking about how beneficial they'd found those strategies. So it was really nice to sort of go back to those parents that, you know, were sort of over a year since they'd attended the groups. We asked them questions like, was there anything that could have been done differently? And also, was there anything that sort of made it difficult for those parents to attend the online sessions? So we're going to go on to the PGL findings now.
Me speaking when I'm muted. Okay. It was very interesting looking at the findings from the PGL interviews. And PGLs actually found their role to evolve smoothly from being a trainee to be PGL, being parents themselves. And the training actually enabled them to help parents understand that every child is different, and the same strategies may not work for all children. I think that's very, very interesting, and they related to that very well. And the program parent group leaders also found the role to be very much rewarding, and they felt that parents could relate to them, and that confidence of parents grew, and that they could use the knowledge gained with their own children. It's again trying to use everything that they were actually using in the training with their own children, and that particularly sounded very, very interesting. And use of technology, especially because it happened on Teams or using Zoom, the technology was considered beneficial, but then it was challenging considering that lots of kids were around them, and managing kids and the training must have been really, really difficult. So, yeah. I don't know if Jen wants to add anything more to this, Jen?
Yeah, it was challenging, as you can imagine, having children anyway in a lockdown environment.
Yeah.
But also the technology, as we found this morning, sometimes doesn't like to play ball neither. So there sometimes were issues there, but overall, I think it was a positive way to deliver training during that time.
Yeah, yeah. And some of the PGLs also mentioned about their own personal issues as well that they had to deal with, especially being COVID time, really.
Yes.
And further, there were improved relationships with families and better communication with other parents in the community, especially because everybody felt isolated, and this was a really good opportunity to come together and perhaps share knowledge and understanding. And the EPEC was seen to be a very, very useful training there. And they also saw empowerment in different ways relating to believing in themselves and their children, their confidence, ability to make choices, deal with problems, and provide strategies to be a good parent. Again, it's such a interesting and very good way of bringing together what empower means to different PGLs. Really interesting. And they also found EPEC training to be positive, and it enabled them as parents as well as PGLs to support their families and also each other during the pandemic. And I think this was felt very much positive, mainly because of the networking that's happened through the EPEC program. And I found that very, very interesting. Thank you.
Okay, so my role was to look in detail at the individual parents' transcriptions, and for me it was extremely rewarding. I feel very privileged. There was it was just rich. That's all I can say. Rich in what the experiences that they shared. All 7 parents were extremely positive about the EPEC, and a number of them, I think, I'm just thinking now, we've been out of lockdown now and it feels life back to normal, but I think when you look back, it was so strange to have gone down into lockdown. We'd never experienced anything like this before. There were some new families there, fairly new families with little ones, and complex things going off in families. So they were struggling with a number of things, and we've highlighted some of those issues. And the parents were saying, that the programme is like it's offering us a lifeline during the pandemic. A number of those parents had felt all of a sudden they've been cut off from obviously family, friends, but also from other professional support services, and that knowing that they could meet and talk to other parents and their PGLs was this lifeline for them. I think they were juggling, particularly in some complex cases, children that had got like delayed diagnostic assessments, so some complex disability health issues there. The worries of shielding some very vulnerable children from COVID. And then, as I say, limited professional support from health visitors and teachers. So they really did see this as their lifeline. I think as well, they talk very much about all of a sudden becoming a dual sort of role within the family. Some parents adapt very quickly to homeschooling, but then, a parent and a teacher in the same social space. So it was a lot for some parents to get, to get used to, and with the different age bracket of children. We said that about age 4, but up to 19, so varying needs, and the children all in under one roof 24/7. So I think, there was a lot going off during that time, and EPEC was extremely supportive. And I think, I suppose, what it felt like for the children too, to the loss of the home, the school routines, and so just this blending. So a very complex, I think, very, very complex time. I don't know whether Emma or Jen, anything else to add there?
Yeah, I think, you know, some of the parents that were involved in the interviews, you're right, Paula, that, you know, we had one parent in particular that had her child diagnosed with autism during the lockdown, and she was so grateful for the Being a Parent programme to have an opportunity to sort of be surrounded by other parents, and be able to sort of share those struggles, but also for her to have an opportunity to sort of share the difficulties of having a child diagnosed with autism during the lockdown, because she'd felt very isolated because a lot of people sort of lost their support network. And it was so lovely to hear the parents talking about how much they enjoyed and benefited from attending a group on an online platform, because I know a lot of services did stop, unfortunately, during COVID, and that was one of the reasons why we were so passionate about being able to offer this on an online platform, because the feedback that we gained from the parents was just phenomenal. And I'm so grateful that we've got this research to capture those comments from parents, because it just proved how hard it was for a lot of those parents, particularly having to deal with the homeschooling side of things, but then also having to be the parent as well.
I think that came across not just verbally, but I was watching those records, so you could see non-verbally, you know, the just how positive everybody felt. So yeah, I do really feel privileged to have reviewed those. So very, very positive, and we can see the struggles there. So the next slide is what they wanted. Sorry, if we could go back one, I think. So what they wanted was to get to understand the children more, to improve communication. That came across very much, and to have these strategies. And I think what was really nice, one parent said, I developed a whole different language to be with my child through going through the EPEC programme. So I think as well, parents felt that the words that they sometimes felt abnormal, the things that were happening to them, and by actually, you know, working with the PGLs and actually sharing their stories with other parents, they felt that they weren't abnormal. These things are actually happening to other people. So it really, they did grow and said that they had grown in confidence. And that their mental health as well was really significantly improved by being part of the programme, and that they'd learned that there's no such thing as a perfect parent. So quite a few people were putting across these messages. Most sort of like said, oh, everybody should do it, every single parent, whether you're struggling or not, everybody should go through this. And we're actually saying that they were going to promote it within the locality and tell everybody to do it. So you might have lots of people coming forward, well, hopefully, Emma. But parents had said, you know, it's really turned my relationship with my child around, my parenting around, and that it doesn't matter how low you feel, sometimes things, we now know things can improve. They listed a whole lot of strategies that they feel that have been beneficial, and particularly the I statements, and being positive and trying to look from the child's point of view as well. So, but the I statements were by a number of the parents came out very, very strongly. I think there's so much that came out of, you know, talking about whether they like the online or the in-person. And I think there was pros and cons of both, really, which it was quite interesting. Online, they actually said, well, yeah, we don't have to worry about childcare and finding childcare. We don't have to worry about travelling to and from, and perhaps if they hadn't got their own transport. So that was a big thing for some of them. And they liked the fact that they could go on and off and deal with with the children if they needed to. But then on the reverse of that, I think some parents were saying, well, we can't get a brew after. It's nice to have the interaction with people, and we've really missed that. So I think they were really missing that. And also some were saying, well, the children did distract them at times. So I think, you know, we were trying to see, I think, and to share with Emma, you know, what people felt that they got on the online, because I think you know, everything turned online. And I think, I suppose it's a little bit like that for us with the teaching, and, you know, it's seeing what happened well, and let's not lose some of that. Can we maintain a little bit of that, you know, in what we do? So that is, you know, perhaps one of the messages that is we've enabled Emma and the team to have, is thinking, where is the place of a little bit of online? I'm sure Emma will come back to that in the conclusion.
I was thinking about what stood out for me strongly was that all the parents, they seem to be, well, I wouldn't say suffering, but then they were actually more confined, more isolated, and they were realizing that this new situation is actually creating some difficulties for them. And then it was at some point they were trying to be reassured that it's not only me, everybody else has these problems as well. And it's again gaining that reassurance, and they're developing their knowledge, and confidence was such a huge thing. And I actually saw in my PGL interviews where some of the parents said, my confidence grew so much that I'm doing so well in my education, and some of them even got good jobs as well. So that was very, very interesting and very empowering, certainly. Yeah.
Definitely. And some of the parents that we interviewed, they've actually now gone on to become parent group leaders. After they did the interviews for this research project, they sort of got back in touch with me. And yeah, some of them, I think 2 of them have now trained to become parent group leaders, and they actually completed their first group this morning in a primary school. So it's fantastic that, you know, this programme can really develop everybody's confidence, not only the parent group leaders, but the parents' confidence as well. So the overall recommendations, so there was lots and lots that we sort of learned from you know, the research, and Paula and Chandrika were able to pull together some really good data for us. So these are sort of the key ones that we were looking at, really. So the overall recommendations for me to consider is ways to reduce anxious parents prior to joining. So there was some of the parents that sort of fed back that they felt really anxious about coming on to a Zoom call. So one thing that I've now done is if we're delivering on an online session, I'll speak to the parents beforehand, and I will offer them an opportunity to meet with just myself on a Zoom meeting prior to the group starting, so that they could sort of feel a bit more confident with using the technology, because some parents you know, we're really apprehensive and nervous about how to use the Zoom platform, and as we've seen, technology sometimes isn't on our side. So that is something that I sort of took forward from the parents' feedback, really. But also, I'll talk about it on the next slide as well, but how I can support parents on a face-to-face group as well. So another thing that came out of it was to consider having a group which is specifically focused on parents who have children with disabilities. So a number of the parents were involved with this research project, but also parents that have accessed the other groups as well. Quite a lot of those parents have come forward with children who have either got a diagnosis or they're going through a diagnosis. So it certainly made us think about how we can support those parents, you know, who might have children with neurological development concerns, or also you know, for those parents as well that might feel quite isolated about having a child with a disability. So that was something that we looked at. Encouraging more dads to attend. Although one thing that was highlighted was that some parents may prefer an all-female group, so that's something that we need to consider. But it is something that we're always working on within the Early Years and Family Support Service within Flintshire, is how to engage more dads into the programme. And one of the things that EPAC down in South London, they've sort of been looking at their data, and they have actually found that they've had an increase of dads attending the programmes when they've been delivered on a virtual platform. So they are now looking at running specific groups for dads to attend. And what I would love to happen in Flintshire is to have some dads that train to become parent group leaders. So then hopefully that would then encourage more dads to attend. since we've done this research, we have delivered a number of online groups following this, and that does seem to be when the dads attend. So we've just finished an evening group, and we had two dads that attended those sessions. But actually, we've got two dads that are going to be attending some groups that we've got starting tomorrow and Friday. So it is something that we're still really trying to work on, and hopefully it is something that we're going to be developing in Flintshire. So another recommendation was to continue using both virtual and in-person delivery. So obviously Paul has spoken that, the parents expressed that there's pros and cons to online delivery, but they were also sort of saying it would be nice to move to face-to-face delivery. We were restricted with that because of COVID regulations, but touch wood, now that they've relaxed, we have gone to face-to-face delivery. However, we are still going to keep virtual sessions. And we are finding that offering an evening virtual group is working really well, especially because we're able to reach parents that might not have necessarily been able to attend, because if they were working in the day, they weren't getting the opportunity to come to these sort of groups. So we've been offering evening sessions online, and they've worked really well, but we have also gone to face-to-face delivery again. And the last recommendation is to continue to break down the stigma attached to parent-related programmes. I've been working in the early years and with parents for 12 years now, and that is something that comes up time and time again. So we have been looking at the terminology that we use and the language that we use when promoting being a parent. So we tend to call them groups now as opposed to parenting courses, because of the stigma that is sort of attached to parenting courses. And I think one of the nice things though about EPEC and being a parent is it's really informal, it's really relaxed, and so we're hoping that the more parents that attend, the more people are going to talk about it and spread the word across Flintshire, and hopefully that will sort of help to break down some of the stigma attached. So in conclusion, we found that the research was phenomenal, and we're so grateful to Paula and Chandrika and Chester University for putting this together, really. And we've learned so much from it, and also thinking about how we can further develop EPEC in Flintshire. So moving forward, we're going to continue to use virtual groups to support parents, just because we found that there is so many benefits to that virtual group. And like Paula touched upon it before, about that some parents have fed back that it's easier for childcare, that it's a little bit more convenient because they're able to sit in the comfort of their own home. And so we're really passionate that we're going to keep virtual groups. We still believe that we've learned so much from delivering online that we definitely want to keep that within our project in Flintshire. We've learned how to support parents when joining a virtual group, but I've also taken this learning forward to face-to-face groups. So when we started delivering face-to-face, I was thinking about how I could support those parents that might be feeling anxious, very similar to when they were joining a Zoom session. So what I do now with any parents that are feeling a little bit anxious about attending a face-to-face group is I will meet them before the group starts at the venue, so that they are familiar with where they're going. They can have a look at the room, also have a look at the creche room if they've got children that are going to be left in creche. And also I will meet them outside the venue on the first day and second day, just to help support them walk into a room, because sometimes that can be really intimidating. And it's not something that I'd really thought about before with face-to-face groups, until the feedback came back from the parents about the virtual. And so I was thinking that it's important that I keep that in mind with the face-to-face groups as well. The research highlighted the importance of having parent group leaders delivering our groups. Jen is a fantastic parent group leader, and she can bring so much experience to the groups when she's delivering, and able to share her experience as a parent. And I think that the parents that are attending can really relate to that. We've now got 14 parent group leaders in Flintshire, and we're still growing each year. And I just think there is something really special about having parents that are actually delivering the programme to other parents. So we're looking at running specific groups for parents who have children with complex needs and disabilities. So EPEC have a number of courses that that they deliver, and they also have courses that are for children who have got ADHD and ASD. So from this research, that is something that we're now looking into, if we're able to offer one of those programs. Obviously, there is a lot to take into consideration with that, but that's something that we're in talks with a number of people with at the moment, to see if there is the option of being able to offer a program that looks at specific needs for the children. But we also, next term, we're going to be delivering to being a parent to a charity that supports parents who are carers of children with complex needs. So again, that is something that I'm really looking forward to running. And then the last thing really is to continue to develop and grow EPEC within Flintshire and to reach as many people as possible. So we launched the programme during the pandemic, and we are coming into our third year now, but we're still finding that people don't know about EPEC in Flintshire. So we're trying our hardest to spread the word really, and we're so grateful for Paula and Chandrika to put together this research, because this is going to be so vital to us when we're spreading the word about EPEC and the impact that we're having on these parents. We're able to now show them this research and highlight the impact that we've had with the parents, and really showcase the project across Flintshire to a number of different services, but also, you know, a number of different managers within our council. So I'm so grateful for the research. And then they are just some useful sources that Chandrika and Paula used when putting together the research. So I'm going to stop sharing my screen now.